But, oh, really? Oh my God. Oh yeah, yes, yes.
Good evening, everyone. This is the North Andover Board of Health on Thursday, January 23rd, 2020. I'm Frank McMillan, Chairman, and I am going to call the meeting to order. First item of business is the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next agenda item is the approval of minutes that were previously distributed and corrected.
They have been corrected, critiqued, and I make a motion that they have approved.
Second. It's been moved and seconded to approve the minutes. All in favor, say aye.
Aye.
Aye. It is unanimous. The meeting minutes are approved. Next item of business is public hearings. No public hearings tonight. Move on to old business. There being no old business, we will move on to new business. Agenda item A, review of new food establishment plan review guides.
Yes. So this has been a long-standing project we've been working on internally, as well as with Sweet Safe, who helps us do our food inspections on the annual basis. And basically what we've done here is we've combined all of the food permits and condensed them all from, we had 23 different types of food permits down to 10. And we had one plan review guide for all types of establishments coming in. We broke that up into various segments that were more tailored for each individual use. So we've kind of redone the entire food permitting program just in time to get everything up and online. And now we're on Viewpoint, and we're getting everything done digitally, which is a lot more user-friendly for the businesses coming in, as well as us having to review them and do the permitting. So yeah, put some stuff in your packets to go through. The first page is the current food establishment fees and the permit names that we did. As you can see, there are 23 different classifications, which if you were a new business coming into town and did a couple of different things in your establishment, would be very confusing and could get kind of costly too. So to make it easier and more straightforward, streamlined, we condense it down to 10. The 10 basic categories are nonprofits, residential kitchen, temporary food, seasonal food, which is like a 6-month kind of food permit, mobile food, catering, retail prepackaged only, which is some of your little gas station snack racks, limited food service establishment, which is your coffee service and things like that, in various retail prepackaged places as well, food service establishment, and then supermarket, which is a giant retail store. So it makes it a little bit more easy to figure out who you are in this category, pick it and apply for it, and pay for it. The next page goes through the definitions. If you had a question, you can go through and see what your establishment does for processes and for overall operations, and you can pick what you're going to be. So residential kitchen is a very basic, a kitchen in a private home where non-temperature controlled for safety foods such as baked goods, confectionaries, jams, and jellies are prepared to be served directly to the consumer. So for your farmers markets, a lot of people have residential kitchen permits to go and do farmers market or to do online sales, things like that, where they do very limited number of items that are safe if they're done properly. So those we do inspections for, we give them a permit for, and they have their list of ingredients and their labels and everything like that. They're all basically above board. They're allergen certified, ServSafe certified, things like that. And that goes all the way down to your food service establishment at the bottom, which is full service restaurants, which could include catering and off-site service, things like that. So gives it a little bit of a more specific definition to each individual category. If you can't figure it out, if you do something that's completely specific, we can pigeonhole you into one of these, depending on what your operations actually are.
Brian, where do we have mobile food establishments?
We have a few of them. They're your mobile food trucks, or Pipe Dreams Cupcakes that drives around town. Those are mobile food vendors. So you have them at some of the temporary events, such as sheep shearing, fall festival, things like that, where vendors get permitted for the year, and then they come in and they do different events throughout the season. Then like Pipe Dreams parks on Main Street and sells cupcakes, once a week.
Correct me if I'm mistaken, but there's no fee associated with the food market?
With the farmer's market? No, there is.
Farmers
That's a temporary permit and a temporary food establishment, so they get temporary permits for the farmer's market. I mean, the farmer's market's a little bit different. I do have an application for that. I haven't finished it yet. I don't know if we're gonna use it. But that does fall under a temporary food establishment category because they set up for one day. They sell their goods. They can even prepare on site and serve if they want to, as part of that type of a permit. But essentially, that's just a temporary operation.
Is this new pricing, is this for now future permits, or this will now take effect?
This will
for
not
all the
take
ones-
effect now because our permitting season is the end of February
Okay.
through, or March 1st through February 28th next year.
So some will have an increase in their,
Yes.
okay.
Yep. So the next page on that is which plan review guide do I need? So when somebody comes in and either opens up an establishment, a new restaurant, new store, new convenience store, new operation, or they buy an existing one and then it transfers ownership and they take it on themselves, you have to do what's called the plan review guide. And what that is a new owner coming into an existing restaurant, for example, has to give us their certifications, their menu, their operations, and then that gives us a chance at that point, transfer of ownership, to go through and see what they have in their establishment for equipment, material finishes, layout, things like that, to see if there's anything that doesn't meet the codes as of today. So if something was built 25 years ago, we don't go into existing restaurants and make them completely renovate and add in things that have come into code now, because it's very cumbersome and burdensome for an existing business to do that. So this is our opportunity to say, hey, you know what? You guys don't have a 3-bay sink because you would, prior to 1984, you need to get a 3-bay sink now since you're changing ownership and transferring the permit. And we work with people on doing that and redoing some of the configurations to make sure they can be as compliant as possible. So this is just for them to say, okay, I'm coming in, what type of food establishment am I gonna be? What type of plan review package do I have to submit? So we've done the food permit application as well. This has been revised. And then the next few packets are all the new plan review guides that we have. The original guide was 20 pages. So if you were coming in to do a gas station candy bar rack, you had to fill out a 20-page application and talk about your sanitizer, parts per million, your hot water flow, capacity, right on down the line to your certification, your allergen awareness certification, number of employees, things like that. So this kind of eliminates some of the unnecessary paperwork and frustration on the business aspect, because somebody coming in to do a very small operation to do this entire process can be very frustrating for them and us, because we have to walk them through the whole process and help them understand this doesn't apply to you. It's in the application, but it doesn't apply to you. You don't need that. Well, then why is it in here? Well, because it's a generic application we give to everybody, and they kind of look at us funny, right? So these have all been revised. This is, like I said, this has been a long-standing project that we started like a year ago, and it's finally coming to fruition right in time for the new permitting season, which was our goal. After that, the last thing in this particular packet is a spreadsheet. Obviously, with doing new food permit fees and new permit categories and classifications, we wanted to make sure that we didn't go too crazy with the fees, do anything extraordinary and unreasonable. And we also wanted to make sure that the funds that we took in were gonna match the funds that we took in last year. There will be some fluctuation with the restaurants coming in and restaurants leaving, or businesses closing, things like that, and changing ownership. But so we basically broke it down to the existing food permit establishments, their current permit type, their fee from last year, the new permit type, the new fee, and the dollar change, and the percentage change. So we tried to make it as reasonable as possible and have everybody as close to zero as we could. As you can see, there are some outliers on each end. In light blue are the ones that decreased in fee. Some of the ones that we had in here, like a pharmacy, was getting hit for a pharmacy and a small retail permit. We have then changed that to just a straight retail permit, so that fee actually came down a little bit. Whereas some of the other ones on the back side of it, some of the food service places and some organizations that were limited food service, or a gas station that has coffee bar, pastries, things like that, has gone up to limited food service, which is a little bit more expensive, and there's a small percentage increase on some of those. A few of them got hit a little bit harder, but we tried to make it as even across the board as we could and still make logical sense with the different categories and their fees associated with them.
Brian, is there standardization at all in the Commonwealth of Massachusetts, or is this information site-specific for North Andover?
Generally speaking, it's site-specific, but everybody has very similar categories and fees. I think what happened here over the years was a new operation would come in and they would create a new permit category for it, like I think some of the old existing categories, if you read page 1, healthcare under 50, healthcare 50 plus, were two different permit categories. I don't know what that means. Why not just make it, if they have a cafeteria, food service establishment? So we've tried to combine some of those, gym/health club, or pharmacy/small retail/bakery, supermarket or superstore. Yes, yeah. So, we've done the best.
I imagine that the local businesses would be very receptive of this. It's certainly simpler.
I think the existing,
Fewer permit names and categories. Would you have, like,
Yeah.
26 down to 10 or something like that, 23 down to 10?
yes,
Yeah.
yeah, I think it's just a lot more easy to understand versus looking through that whole list and saying, okay, what's going on here? And we didn't, the only thing that's an additional fee would be caterer, because that's a whole separate operation, but that's in one of the new categories. So if you're a restaurant and you do catering, which isn't delivery, that's completely different. Catering is when you set up off-site and man it for the entire time. So you're responsible for all of the transport, hot holding, cold holding, serving, utensils, hand wash station. There's a whole operation that goes into catering, which is what this is for. It's not a delivery service where they bring trays of food and drop them off for your party, and then you take over from there. So there was some confusion with that as well, where some of the sub shops were caterers, but they just did large-scale delivery, but they didn't actually stay there and serve the food, which gives you all those other steps that actually need to be involved. So I think the biggest thing is the fees, redoing all the fees, and then at the end of the day, looking at the totals from last year and totals from this year, they're almost exact. There's an $800 difference. So I think that keeps us on par with what we're taking in for our accounts to use for inspections and program supplies, and keep the food program obviously up and running as well as it is now.
So basically, we're looking at $27,000 for roughly, almost 200 establishments. What, many of them are the same, many of them are different. How did you determine what to do, what changes to make? What was?
Analyzing every single establishment and
Wow.
knowing what they do, and then saying, okay, what makes sense? This operation does this, this, and this, therefore they would go to this new permit category. Does that jive? Is it believable? Is it crazy and outlandish, or no? Does it actually make sense? And you're gonna believe it when I tell you.
Have you gotten any objections?
No, we started using the new plan review guides on a limited basis, just as people are coming in. We had them finished. You guys hadn't approved them yet, but it made sense for us to start using them. Since they were done, we put a lot of work into them, and it made sense for us and the applicant coming in. So instead of doing an entire packet, you're doing a limited renovation. Here's what you need to give us. This is what we need. So people have actually been very receptive of it, and having an easy way to give us the information versus the old school way. I think it's been very well received so far. And I think as we're getting into the new permitting season, being online with all of this information, with the definitions, the categories, and then being able to see which permit they're gonna be and the fee right there on the computer is gonna be a world of difference for us, I think.
But they still have to come in person to,
Nope. They can do
oh, they get everything online now.
You can do everything online. Yep. So,
Excellent.
we've gotten some good feedback from Panera, loved it. Yeah. Because there are a lot of other towns in the area that also do it on Viewpoint and do it online. So some of the corporations are used to it, and they have other towns in this area that actually do it, so it makes their life easier. Any questions, any suggestions, any comments?
So what?
Yeah.
Thank you. Thank you. Steve helped a lot too. You did a great job. Right?
A little bit.
Move the food cart just so I can apply for a permit.
Go for it. Hot dogs are big business.
Right.
Yeah, I agree with what Brian was saying though. Like we had a, for example, it was like a convenience store style place, just change ownership. They didn't change into the operation. So instead of giving them a 20-page packet, which 3/4 of which they're not, it's not going to be like applicable to them, we could just give them like a, say like a limited renovation packet, which basically they could just fill in the information for their store. And it's very like specific to them. It's not just like asking them about processes they don't do.
When you give them the 20-page application, and 90% of it has nothing to do with them, they kind of gloss over, and they get that look like, what are you talking about? How do I do this? Like, all right, take a deep breath. If it doesn't apply, you put NA. Sit down, let's go through it. So it'll save us time as well as apprehension and anxiety on their part. So I think for that, I'd be looking to adopt the new fee schedule for food permitting for this. Actually, we can adopt the entire fee schedule for the entire year, but with the new food permit fees in here.
Make a motion. All right, I'll make a motion to what Brian said, to adopt the new fee schedule of 1 through 10, moving over from the current food establishment
Yes.
fees. Should I just tack on the whole, to
And-
approve the new
And the
application?
existing- Yep.
And to approve the new food established permit application?
I second.
Been moved in second to adopt the motion as discussed. All in favor, say aye.
Aye.
Aye. All opposed, no. The ayes have it. It is adopted.
All right. Let's see, so, yes, the new fee schedule for 2020. New permit application and Viewpoint, that's all set. Next item on the agenda is discussion topics. I've got a couple things to give you guys updates on. One of them is mosquitoes.
Okay.
So we've already been meeting with the state for the upcoming mosquito season. The state is going around and doing seminars in each region. I just went to one in Andover about 2 weeks ago. This past season was definitely a learning curve for people at the state level all the way down, because it was so active, there was so much going on, and there was so much information being dispersed out there and located in different places. There was so much people had a hard time finding what they needed. So the state basically created a 72-point action plan this off-season to address They've already started addressing them in terms of location of information, ease of information for us to use, to give to the public, best management practices, things like that. So it's already well underway. I am meeting with the superintendent and the athletic director in the beginning of February to go over this upcoming season, because they need to be very involved in decision-making, student notifications, things like that for next fall, basically. One of the things that people have been talking about in the region is thinking about how to handle potential issues with scheduling in terms of nighttime activities. That was a big thing this past year, with things being moved around, canceled, completely altering their entire sports seasons, which I think was cumbersome, and it made a lot of people mad and upset. So I know you can't make everybody happy. I think obviously erring on the side of caution is the way to go. But I think if we plan ahead, we can make it easy. So if they create their schedules this spring for next fall, they could always come up with maybe like a Schedule A and a Schedule B. Who knows? If anything ever happens, they can flip the switch to Schedule B, and it's not a logistical nightmare on their part throughout the entire region with all the other sports teams. Something being tossed around, I'm going to mention to them. That, as well as the Childhood Prevention Act for use of toxic chemicals and spraying and things like that. We can iron out some bugs there. Some of the notification things we can get standardized ahead of time. So if anything does happen, and as you guys know, these kind of go in cycles. They're saying this is definitely on the upswing of this particular cycle. And there's no way to predict it, but they would predict it they would estimate it could last 2 to 3 years, which is the cyclical nature of a virus like this. It comes and goes.
Is this for all of the mosquito-borne viruses or some of them
Triple E, specifically.
specifically? So
Yes.
not necessarily West Nile. Not West Nile.
Correct. West Nile was a very quiet year. Triple E was the big one this year. 4 or 5 years ago, it was West Nile virus. That was the big one. A few years before that, it was Triple E. That was the big one. So going back, 2006 is when there was the first cycle of Triple E coming through, and it's back again. So there's no way to tell. Some of the mosquito control people that we've talked to in the past were at some of these meetings I was at, and one of them did mention to me, she said it's going to probably be a really bad year. So I said, awesome. Let's get ready.
All right.
So, you want to bring that out there? It's being worked on. I just got the best management practices for mosquito control this morning. I haven't opened it or looked at it yet, but I got the new one for this coming spring and fall season to start going through and work on it with them. That's it. Next thing for discussion, in here, there's a national conference, the NACHO, that's National Association of City and County Health Officials, that is taking place in Dallas, Texas, this, the end of March, beginning of April.
Perfect time to be there.
Yes. And if you look on the last page, the front of the last page,
Oh,
the
man.
list of speakers,
Yes, I
Oh,
saw that.
man.
and on the very last page is the topic. I'm in section B. We'll be talking about the gas event and the public health response to the things that we had to deal with. In November, Tom Carboni from Andover, Joanne Belanger, who's in Andover, but she's the MRC director, Felix from Lawrence, and myself did a presentation at the Massachusetts Health Officers Association on this specific event and the stuff that we dealt with at the beginning of the event through the heating season until everything was back up and running. And actually, Steven sat there in the audience and learned a lot, I think.
It's a good speech.
So we've been invited to, and we are going to be speaking at this conference. I hope to actually learn a lot. It's a 4-day conference, so I'll be attending the conference for the whole time and taking other classes and sessions through the entire time that I'm there. Then the last piece, the last thing in your packet is the CDC advisory on coronavirus. So as you know, it is similar to SARS. It's a respiratory virus that has been discovered over in China. It's starting to travel a little bit through a few other countries. There was one case in Washington State. They are taking the same precautions worldwide through the World Health Organization as they did with SARS to try to contain it. They've definitely done a really good job since this just started a few weeks ago in detecting it and trying to contain it. I don't know if you guys have heard anything on your end.
Monday,
Through-
this tracking the stock market, it was up, then it went down. And I said, what is this all about? And I said, well, maybe it's because of the impeachment trial. But it wasn't. It was because of the coronavirus issue. And I heard today, although I haven't confirmed it, that flights from Hong Kong, the people, I don't know if all of the passengers, but at least some of the passengers are being checked for that right now.
Yeah, they're doing screenings now at a lot of the airports. Are diverting some of the traffic through. There's 3 in the U.S. right now that are screening planes coming in from Hong Kong. I think San Fran, JFK, and LAX. They're going to be doing Chicago O'Hare as well as Atlanta very, very shortly. All planes coming from Hong Kong and that area will be directed to those airports, and passengers will be screened. Boston is not on their list right now. I think there was some passengers from Logan that were screened, because that flight came in right around the same time they started screening everybody else. So I think they have it under control. We'll see how these things pan out.
So my understanding is the city of Wuhan is the epicenter of the genesis. These coronaviruses are thought to occur in mammals and birds. They can be spread by bats. This particular virus does not yet have a documented human-to-human transmission yet. So it's thought to all be associated with a particular marketplace in that city in China. So it's clearly deadly in some people. Others survive it. The person in Washington State is expected to survive it.
I read in the Wall Street Journal this morning that in Wuhan, what the Chinese have done is they pretty much quarantine the city. There's 11 million people that live in Wuhan, and you can't get into it, you can't get out of it. And they're trying to contain.
soldiers.
They're trying to contain it. Unlike
Yes.
the SARS virus a number of years ago, that was really bad. And I understand, of course, we have 2 doctors here, they may want to comment further, but I understand the symptoms are quite similar to the flu. And I don't know
Yeah.
much more than that.
Respiratory.
I think this is just more of a reminder that everybody should just get their flu shot. I think the flu is just more dangerous than
Definitely get your.
this virus. I mean, yes, it is similar to what SARS was, but this is still so small that we don't know what the capabilities are.
It's interesting, because I had heard that it is human-to-human contact, but that information was preliminary, and Frank says, no, it's not. Now, I know the SARS was animal to people. I thought the same with the coronavirus, but I guess not.
It's a different coronavirus.
Yeah, yeah.
You have the joke.
To piggyback off of the coronavirus, for our Emergency Preparedness Coalition in the region, we've been doing flu clinic drills for years. This year, we've kind of broadened it a little bit, and we're doing a tabletop exercise. tabletop exercise is on the 28th, where upper management from here, as well as some department heads, are all going with me to Methuen Police Department, where there's going to be a regional tabletop. So 8 communities, leadership, police, fire, public health, emergency management directors are all going to be in a room and handed a tabletop exercise. So on the specific event is going to be an emerging infectious disease, which is part of our response plans for public health for anything that comes around. So it could be used for anything such as a hepatitis A outbreak in a food worker to something like this. This started way back in the early 2000s with the anthrax scares. They started teaming together. We created these public health coalitions to work on and plan for biological attacks or natural disasters. So pandemic flu, swine flu, bird flu, biologicals, coronavirus. And just so happens we've had 2 planning meetings so far with upper management here, and we'd have our tabletop next week. So this is perfect timing to talk about something like this. We've had a great turnout. Town officials have been very involved and more than willing to spend the time looking over our emergency dispensing site plans, getting the information and trying to learn it and absorb it, and volunteering and acknowledging that we need to do the tabletop exercise and go from there. So I mean, that's big strides, because for many years we've always been planning in silos. We've luckily started to branch out now and bring in other departments. Fire, police, emergency management have always been involved, which is really good. They're being more involved now, realizing that there is credible threats out there that they have to deal with and they have to know how to, contend with. Yep, so that's next Tuesday.
Speaking of shots, of flu shots and other shots, as we know, but I'm not sure that everyone that is watching knows, our town nurse, Carolyn Ibbotson, her office is in the senior center. The feedback that I have received from so many people in our town in general, in the senior center in particular, is that she has really done a good job. So you may want to quickly comment on the type of shots that she gives and the eligibility to get one of these shots.
Well, we have flu shots, so anybody, childhood through seniors, we have flu shots available. We will have them available. She does have an ongoing list for shingles. The shingles vaccine is very hard to come by and is very expensive, but we are putting in orders. We have done a few rounds already. We are getting more. That's going to be up to date. We did just receive state certification on our vaccine storage system. So we have a vaccine grade refrigerator. It's on backup power in cases of any power issues. It's got data loggers that report directly to DPH and us if there's any issues with temperature control. So now we are on board with the state and getting state-supplied vaccine for MMR, tetanus diphtheria. I mean, you name it, we can get it now if there's a need for it. We have the ability to get state-supplied vaccine as well as purchase our own. So we've come leaps and bounds over the last couple of years with Caroline as our nurse.
And you mentioned the flu, you mentioned the shingles and pneumonia. You've got those shots here too.
Pneumonia,
And the other ones that
HPV.
you just...
Yes, yep,
Do you have hepatitis A?
no. That's only on an as-needed basis, I believe. And that's it. So, yeah, get the tabletop. I'm looking forward to that. We put a lot of planning into that as a region, and it's actually coming to fruition, which is really good, with literally 8 communities. Complete buy-in from every community is going to be there, with upper management, public health, police, fire, emergency management directors. It's going to look really good.
Any feedback on the update on the tattoo regulations that went into effect January the 1st this year?
Yeah, so I've been starting to do the inspections. We don't have too many in town. I think I've done 2 already. Obviously, with the updated regulations, there are some issues that we need to address, but they've been more than willing to work with us, and we've been working with them to basically get them into compliance. So it's been going good so far.
How about the tobacco regulations that also have been updated and I believe effective January the 1st too?
A little bit of pushback, not a lot, but some grumblings and some frustration. Some of the retailers that had product were worried that we were going to shut them down and fine them for selling. I spoke to them. A few of them said, look, if you've got a couple cartons of menthol cigarettes, just tell them to get rid of them. Just get them out of here. Don't order anymore. And they were very thankful and appreciative. They were just worried about eating $1,000 worth of product. I said, you know what, we're not here to hurt your business like that. Sell what you have, make your money back. Just don't order anymore, and the state's gonna be having a hard deadline in June, so get used to it now. But aside from that, pretty much straightforward.
That hard deadline that the state will have in June, it still is not as restrictive as what we have here, and, at the end of it.
Same thing, same menthol ban, e-juice, things like that are all at certain areas now versus.
What is the main difference between the state and the town?
I think it's just timing. I don't remember what the exact differences are off the top of my head. I know we are more restrictive, which is good.
Well, I was thinking of the federal government. The federal government has relaxed. The federal government did say, well, no menthol cigarettes, and now I believe they're saying, well, menthol's
Are
okay, yeah.
getting involved, but we've already done it, so I'm happy with that. So we're good. I'd like it to be done at the federal level, which would be fantastic, but it's politics.
I think New Hampshire is taking up, talking about taking up some of these
Really?
laws too, yeah.
I like that. They're always a little bit behind us.
But they're also probably getting some of the benefit of the
Yes,
strict
they are.
laws.
Yeah, I think when Massachusetts did the vaping ban, a lot of the stores right along the border here made out very, very well. And I think they still are. But that's it. That's all I got for tonight.
Okay. Any other topics of discussion? Do I have a motion to adjourn?
I make a motion to adjourn.
I'll second.
All in favor? Aye.
Aye.
We're adjourned.